Thank you. So, good afternoon, everyone. Welcome to this month's Opioid Settlement Advisory Committee. My name is Shalisa Howard Martinez. I'm with Aging Well Durham, and I am the community-based organization representative on the committee. I also serve as the co-chair along with Brittany Price, who will be joining us soon. Before we do our agenda review, I'm going to ask each committee member to please introduce yourself. You could just share your name, the organization that you're a part of, and also what is the seat that you are representing on the OSAC. So I'm going to start with Karen.
Hey, good afternoon, everybody. Karen Kelly. I'm the Chief Program Officer at TROSA, and I have I think the business seat at OSAC. And I will kick it to Paul. Hey, Paul.
Hi, Karen and everyone. Good afternoon slash evening, whatever we refer to 5 o'clock as. I'm Paul Nagy, affiliated with Duke. I'm on the faculty and department of psychiatry. It's a licensed clinical addiction specialist, licensed clinical mental health counselor. And I believe I am representing education. And with that, Jamie, I see you're here. I'll hand you the
Hey,
baton.
Jamie Carter. I work at Lincoln Community Health Center doing primary care and addiction medicine, and I'm in the healthcare provider seat, and I will pass it to Dawn.
Dawn Baxton, Chief Public Defender, and I believe I'm in I think it's called law enforcement or something seat. Um,
I think that's everyone who's here.
everyone who's going.
Yeah, I think so, Dawn. Thank you.
Okay.
Thank you, everyone. And so I'm going to go ahead and start sharing our agenda. So we had the meeting called to order. We have a couple announcements that we wanted to share with you today. And then we're also going to talk about our next steps for the FY 2027 funding recommendations that the committee wrapped up just a week or so ago. We're also going to talk about revising our bylaws. The committee approved the bylaws earlier this year, but we still need to add some pieces to it. And then we're going to continue our discussion about learning priorities. We also began this discussion closer to the beginning of the year, and we want to make sure that we're still identifying the learning priorities, the guests, but also more importantly, or just as importantly, I should say, come up with a schedule for how we're going to just build our collective understanding and capacity around the priorities. Then we'll talk about agenda items for our next meeting, and we hope to wrap up by 6:30. So I'm going to go ahead and share some slides. And I want to welcome Commissioner Jacobs to the meeting, and also Lofton Wilson. So Lofton, could you also introduce yourself and just share your name, your organization, and also the seat that you're a part of as being a member of the OSAC, and then we could go to Commissioner Jacobs.
Yeah, thank you, Shalisa. I'm Lofton. I work for the North Carolina Harm Reduction Coalition at the Community-Based Learning Service Program. I'm in the outreach band right now. And I serve on the person with lived experience with opioid use disorder seat on the committee, and I'm happy to be here.
And Wendy?
Hi, everyone. I'm Wendy Jacobs, Durham County Commissioner, serving in the elected official seat.
Okay, thank you, thank you. So the first announcement we have is that we know we have our community meeting coming up on June 4th. It's going to be, I believe, at 5 o'clock at the County Commissioners' Chambers. The question we wanted to ask or bring to the committee today is, We have an opportunity to also participate in a panel discussion to share with the attendees about the committee, the work that we're doing, that we've already completed and that we hope to complete over the next couple of months. We wanted to find out, are there members of the committee who'd be interested in participating in a panel discussion at the community meeting on June 4th? Going once, going twice. I'm looking through to see if I can see eye contact as well.
I'll
I
jump
mean,
in.
if you're needing people to volunteer, like I could do it. I could participate. It depends on the timing, I guess, too.
Okay, what was the
Yeah.
ask? I'm sorry.
The ask was for committee members to participate in a panel discussion at the community meeting, just basically describing what we do here at OSAC, what we've already completed, what we're hoping to complete over the next year. If there are questions from the participants, the audience, be willing to answer questions, things like that.
Do we know the time of the meeting?
Let's see. It is going to be on at that's not the correct one. It starts at 5 o'clock. So the same time as our meeting here.
On June 4th?
Yes.
Okay. So here's the issue. I wouldn't mind, I wouldn't mind participating on the panel, but I'm not certain that my responses would necessarily be favorable to what we do and what we've done. So you
Okay.
might not want me on the panel.
Okay. Thank you for and we'll
I think we can do more than spend thousands of dollars in syringes in the naloxone. And so I don't find that as something we need to be touting too much.
Okay.
Because that's managing the problem and not fixing the problem.
Thank you. Thank you, Dawn. Thank you for that, for your for sharing. So I'm hearing Jamie, you might be interested. I think
Yeah, I'll just be in clinic until at least a little, 5 or a little after, so I could come late, but I'm not sure if the timing would work out. But if it's going to be in the later part of the meeting, then I could do the panel. If not, I may not be able to make it in time.
and hopefully the agenda will be coming out soon. We'll be hearing from Jason about the agenda, but if there are other members of the committee who are interested, you could just get in contact with Brittany and I. I know Brittany and I also be willing to participate in this panel discussion as well. So that's the
Yeah, I think
oh,
sorry, Shirley, I was going to say, I think if you and Brittany represent us, I think that sounds good.
Okay. All right. The next thing as far as announcements is, unfortunately, Kay Sanford has resigned from our committee. First, we want to just thank her for her contributions and service, not only to Durham County, but also to North Carolina. And so there should be an announcement coming out pretty soon in next month to replace her role on this committee. She was the social services provider for this committee. Our goal is to have a new member join the committee in July. And so that's just an update about what's happening with Kay Sanford and also that seat. Are there other announcements that anyone wants to share today? Okay. So our next thing on our agenda are just our next steps, or the next steps for our funding recommendations. Again, we just completed this process about a week or so ago. Thank you. First of all, I want to just thank everyone first on the committee here, but also to the entire Durham community, just for your patience throughout the month of April as this committee went through that process. Jason Smith, who is the opioid manager, he will be presenting the committee's recommendations to the Durham Board of County Commissioners soon. And then after the board makes decisions, then the information will be shared with OSAT, who is the Opioid Settlements Technical Assistance Team. They are going to review the budgets to make sure they align with the allowable expenses and the MOA. And then after that, it should be just a contracting process. Does anyone have any questions about next steps for this year's grantees or funding recommendations? Okay.
So Lisa, I did have a quick question for you, or not more so a clarification, if you can hear me.
Yes, we can hear you.
Awesome. Good evening, everyone. Just wanted to just make a quick little clarification too. The recommendations, we're going to submit it to OSAC before we submit it to, yes, I'm sorry, we're going to submit it before and after the board makes the decisions. So we have to do a preliminary review first, and then it'll go to the board, and then we'll submit it back to OSAC. That was all.
Okay. And I'll make sure
Thank
to update the slides to say that, Jason, about the preliminary step.
Absolutely. Thank you, Shalisa.
Thank you. Any other questions or comments about next steps? Okay, moving right along. So,
Hey, Shalisa,
At least I
Dawn,
had my hands up.
and then I had put mine up after Dawn.
okay, go ahead, Dawn, I'm sorry. I didn't see your hand.
Yeah,
up.
my question was to Jason, does he know when he will be presenting it to the county commissioners?
Hey, Dawn. I do not, as of yet. I do not know that exact date, but I am working on putting in paperwork. So I guess that timing I am unaware of at this point. But as soon as I do know, I will be sure to make sure this committee is the first on my list to know when that time is.
All right, thank you.
Absolutely.
And then Wendy?
Yeah, I was just wondering, will the committee, I guess you, Shalisa, and Brittany, write any kind of a memo, or Jason, or we're working with Jason, just any kind of just something that explains the decision-making process and the RFP and the rubric, and just how, the decision of how the recommendation came about.
Yeah, and actually, Brittany, let's see, has she joined us yet? Brittany began drafting a memo this week, and so she and I are going to work together on getting that complete, and we plan to coordinate with Jason to make sure that there's not a lot of duplication in between what the memo says and what his presentation is going to be. But yes, we are planning on drafting a memo.
Okay, that's helpful. Thank you.
So, and Dawn?
In response to Commissioner Jacobs' question, in this memo, when you're drafting it, what rubric are you going to say was used, since there was at least 3 different processes?
Yep.
And
So
the last one did not have a rubric. So I just want to make sure whatever memo that we're presenting is authentically detailing this entire process and what happened.
Absolutely. So the memo does include the working groups process and their rubric, and it also includes the description of the process that this committee used, and also explanation that this committee did not have a rubric or a consistent way to assess the applications. So it's also a document we hope will be helpful for our debrief meeting. We still need to have a debrief meeting of that process. And so, yes, it will include all of that. Any other questions about the funding recommendations or comments? All right. So we do have a set of bylaws, but we do need to go back now. The committee does to add information, just as Dawn just described, about how moving forward we're going to score proposals or make recommendations around the RFP process. We need also to have our review process be in line with Durham County's procurement practices. And so that is something that this committee needs to do, and we need to figure out a time to do it pretty soon, because even though we're already in May, so the year is already gone pretty quickly, or moving very quickly, we also have some set dates that we have to make sure that we are meeting certain timelines. So if, for example, in December, the new RFP for next year will be released, and hopefully the due date for that will be in January. In February, that's when we'll begin the review process for the proposals that come in. And in March, we have to make our recommendations. So sometime between now and the end of the year, we have to get back and look at the bylaws and figure out what is our RFP process moving forward. How are we going to make these recommendations? And Jason, I see your hand up.
Hey, Lisa. Just want to make another clarification here.
Okay.
We are uncertain around any RFP being released in December. We don't know anything about an upcoming RFP.
Okay.
So that's a little bit uncertain. But I will say that if there's any iterations or any newfound recommendations that you guys find out, that will be due in January 2027.
Okay. Okay.
And that's all.
I was using last year's timeline for that, and I forgot to ask you about that. Like, was that the also timeline for this year? So thank you for that, Jason. I'll make the update about that as well. But just a heads up for the committee, just this is another thing that we have to get done pretty soon, as quickly as this year is moving already. Any questions about our revised bylaws? Go ahead, Karen. Yep.
Thanks. This isn't really a question, but just I think just to make sure I'm clear, it seems to me like we can't really add that to the bylaw until after we've had our debrief meeting, and I'm assuming out of that debrief meeting might come changes to the process that we used this year.
Yeah. Hopefully, yes, absolutely.
Yeah, yeah.
Changes in agreement about how we're all going to work together for next year. And so I
Yeah.
agree. And in fact, we want to go ahead and it's near the end of the agenda, but I can go ahead and say that we're hoping to have the debrief hopefully next month's meeting, so that we can go ahead while this process is still fresh in everyone's head around, what happened, what should have happened, what didn't happen. But yes, we hope to have the debrief meeting soon and to use that as a learning experience to move forward.
Thank you.
You're welcome. Other comments or questions around our RFP process and adding it to our bylaws? And I see Jason has put the invitation for the community meeting, the June 4th community meeting, inside the chat for anyone, and also has a QR code for people to register. Thank you, Jason. So now we're going to get into our learning priorities. We've already generated a pretty good list of learning priorities. We also talked in March about structure for the future meetings by like which stakeholders we wanted to invite in, and also how we wanted to coordinate with the stakeholders. For example, making sure that questions were available to them prior to the meeting so that we could have more supportive discussions. I'm going to go ahead and pull up a Word document that has a list of all of the already identified learning priorities, and also possible guests that the committee has already discussed inviting in. And also, again, we hope today to make a calendar for this process of figuring out what we need to know and who we need to talk to. So here we go. When we met back in February, we began developing this list. Is everyone able to see this, or do you want me to make it larger? Is it good size? One of the learning priorities and questions was around community data. So key indicators, metrics to evaluate current programs and trends. What gaps do you see? What gaps do we anticipate on the horizon? What gaps already exist in the data? So that was one big piece. Another big or a part, a learning priority the group has spent some time thinking about is listening sessions with program personnel especially. So this was the set of questions that the group identified in March. So what barriers exist in your current work? What gaps do you see? Again, what gaps do you anticipate? What gaps exist in the data? Feedback that the program folks are receiving from their clients, participants, patients, what has been working for clients, participants, patients, what disparities do we see in our work, what other impactful barriers and gaps are participants, patients, clients experiencing, what do you see on the ground with respect to opioid-related harms, in particular, what's different this year than it was before, and also thinking about gaps for people outside of Durham city limits. We had a category around root causes, landscape changes in policies like Medicaid, successful demonstrations in other regions. What have other communities learned through this process, and what can we take from what they've learned and improve our process here? Current funding commitments. I think we've learned some things through the RFP process that we've just completed. Also reviewing SAMHSA and other federal funding opportunities to avoid duplication. And this question about the North Carolina Association of County Commissioners is meeting this year in Durham County. Isn't it possible to have opioid settlement funding topic be included in their discussions? And then we also have a list of guests that the group has already identified. So before we start thinking about when we want to invite in guests and what learning priorities we want to hear from them, are there other topics or questions that we want to add to the list that has already been started?
I would add maybe one. I don't know where it fits in the list of priorities. It might not be a top priority, but um, I'm just wondering about the UNC drug testing lab and kind of us as a group learning more about what's happening to the changing drug supply and what's in the supply and how that's changing.
Other questions? I would say for myself, one thing that I felt I need more information to know about is about early intervention. What are promising practices? And also housing. Many of us attended the Durham Joins Together coalition meeting, the April coalition meeting, and there was a discussion of, after one of the presentations about housing and gaps in Durham. So that's another one that I'm interested in myself, but what about the other committee members, other priorities that we can put on our list here? Okay, so we have a pretty good list too. That's the other thing. We don't want to because eventually we're going to have to start prioritizing if we make a very, very long list, right? So how do y'all feel about us starting our calendar? So that way it'll help us plan and also give us time to reach out to the guest speakers, find out if they're available, coordinate the sharing of questions ahead of time. How do y'all feel about us moving ahead and developing our calendar, our learning calendar? Okay. So we are already in May. We hope to have the debrief meeting in June. So I've already put in here the debrief meeting in June. I don't think we'll have enough time, honestly, at that meeting to invite in a guest. I forgot July. Let me, thought I was forgetting them. So what about July? Who would y'all like to invite in, or which priority would you like to learn more about?
When would that July meeting be?
It'll be July.
Oh, well, let me just say, I'm glad Dawn asked. We tend to like try to give staff a break during July. I'm sitting here looking at Jason
Yeah,
and seeing Rod and Joanne on here, other public health support. So that's kind of the 1 month that we try to maybe not have a meeting.
yeah.
I
It's not,
mean,
it's not
no,
accounted for July 13th, but yeah, I think it is. Let's find out. Jason, yeah, I see a heart. Jason. So July, we're not gonna have a meeting. We'll take a little break. I think that makes sense for I think a lot of organizations. I know we do also at Age and Well Durham, try not to meet in July. Um, yeah, okay. So what about August?
Okay. So one of the things, the question was what we like to hear or learn more about.
Yes.
I would like us to learn, if the slide could go down the part where you had learning from other,
Mm-hmm.
what was it? Successful demonstrations in other regions, learned lessons.
Uh-huh.
I would like, I'm hoping that will include learning what other regions have done besides naloxone and syringes. I'm just excited to hear something else other than providing an abundance of naloxone and syringes to deal with this crisis. I mean, I feel like we have this opportunity to make a difference in the community, and I would hate for us to look back 10 years later and the story be that our decision to address this problem was an abundance of syringes and naloxone. So I would love to hear what other regions have done in addition to other than naloxone and syringes.
Okay. I'm gonna copy that down here.
Please.
Yes, I'll put that in August. And I think Jason, when we talked about this earlier, you had been, or you offered to or to identify some other groups because you're in contact with folks regionally and also all across the state, right? And so,
Yes, absolutely, Shalisa. I can get any county that you need, whether you want a region or any specific counties. You guys just let me know, and I can bring them to the table.
sure. So, is there a specific county or region that we want to invite in? Like, does anyone know or has been paying? Yeah, go ahead, Karen.
Yeah, I was just gonna ask, um, Dawn or Jason, do you guys have ideas about who we might ask about who's doing this? I also wonder if the Association of County Commissioners meeting, if that might be a place where we might learn where there are these innovative programs. I love this idea. I just don't, I'm curious how to best find them.
Yeah, I guess I can jump into. Yeah, we do have that. We have a monthly meeting that we have across the state, and unfortunately, it is only reserved for the opiate settlement. That those individuals work in the settlement. So that means unfortunately it's not an open meeting. But there are, like I said, there are Region 5. We have a quarterly Region 5. So that might be, like I said, once like Chatham or anyone that's in our region, Orange. So those are closer to home. So those might be that might be spark some interest with you. But then there's also bigger counties such as Wake or Mecklenburg as well. But I think just maybe listen across all of them, you might get a sense to see like how they're all structuring their work a little bit differently, even from their advisor committees, the program that they're spending money on. One of the things that we look at is that percentages around different strategies, but why those specific counties are doing like those specific strategies because everyone has a very unique, approach and population that they're serving. So I mean, honestly, it's whichever route you guys decide to go. I'm more than glad to help. I think Director Jenkins also well connected. He also can connect to anyone. So you guys put me in the direction you guys want to go, and yeah, I'm more than glad to help out. But if you guys have questions about what specific counties are doing, I could also pull that information for you and just send it along.
Thank you. And I see Jamie and then Wendy.
Thanks. Yeah, I was thinking it might be useful to hear from the leaders in Durham Joints Together about sort of the big picture in Durham and the gaps in Durham, and then maybe also from like the listening sessions with sort of the content area experts, the harm reduction folks, the housing folks, the treatment providers in Durham, just to see like, okay, we know these things are going well in Durham already, and these are the gaps that we've identified, and maybe then reach out to see where are there places that are kind of having best practices that fill the gaps, because I feel like our time is pretty limited between now and the end of the year, and it just may be that we get a presentation like Wake County's doing this and this, and it's like, well, great, Durham already does that well, so we don't really necessarily, that wasn't necessarily the most useful. I think it might, I think I would like to hear from the different groups working in Durham and where they see the gaps. And I thought when I was at the Durham Joints Together meeting last time, that I think the people who are attending that meeting already have like a very thoughtful ideas about sort of the big picture of, the different levels of treatment, the different kind of housing options, and kind of where the gaps are. And so maybe starting in the earlier meetings with them could be useful.
And then Wendy.
Yeah, we kind of missed that has been delayed, having Durham Joints Together, which I do co-chair with Dr. Wanda Boone. But I think having the three committees, even trying to get them to come to the same meeting, so education and prevention, and harm reduction and treatment, and then now the housing committee. There are now three committees, to have the chairs present, give them a lot of time, but to present an overview of what is being done. And they couldn't even survey if we have questions of what related to the questions you shared, Shalisa. And then if we have those targeted questions for them to respond to around like gaps and data, I think would be a really good starting point, because honestly, I participated on a statewide opioid committee for the North Carolina Association of County Commissioners. And, a lot of the best practices we are already doing in Durham, evidence-based practices, and they are being supported by a lot of them in this recommendation that the committee's putting forward. But to start there, and then the other suggestion I would have, maybe Jason, after like you offered to kind of, do some of the due diligence, is that Nidhi Shkashka Devi, who is she is the person who's overseeing all of the opioid, helping all of the counties with their opioid settlement best practices. And so she's actually going to know exactly what's going on in every county. And so maybe Jason could consult with her for like a follow-up meeting, to Dawn's point. And, she can come in and share what we may, looking at what we're doing compared to what other counties are doing, and make some suggestions. So thank you, Jamie and Dawn.
Yeah. So I'm hearing like two things. One is, or I should say options. One option is to go ahead in August and have learn about what other communities are doing, learn in addition to naloxone and syringe exchange. And then I'm also hearing that the other option is first we hear from Durham and learn about the gaps here. And then from there, that's when we figure out which other communities we want to learn about, or what other communities are doing that's a little bit different.
I think Jamie was saying to start first with what we're doing here.
Yeah.
And let me just clarify, I think it's misrepresentative to say that all we're doing is syringes and naloxone distribution. That is not what we're doing in Durham, and that's not what the committee's recommending.
Okay. So the two options, one is we go ahead and we learn, or we reach out to other communities and find out what's happening with them, with their advisory committee structures, their priorities around funding, different strategies, anything innovation, any learning that they've already collected. That's the first option. And then the second option is we invite in Durham joins together the committee co-chairs from the three groups that they have, the three committees they have there, hear about what's happening in Durham, what the gaps they see already here, and then we move to other communities. I think we just go ahead, Dawn, and then Karen.
Yeah. I was going to say the reason why I think it's important that we start with figuring out some or hearing about other successful demonstration of what other regions are doing and other advisory committees are doing, because ours, let's be honest, has operated in a very dysfunctional, unorganized way, especially with this last process that we went through in recommending to the commission what they should consider funding. And so I think it will be best, especially since we're talking about looking at our bylaws and restructuring those to include those things, to see what other counties are doing to get some guidance. I mean, we can always call in the Durham people to let us know about what the gaps are. But I think it's important for us to figure out a better way for us to function as a committee first before we start recommending or doing anything else.
Okay.
There has to be a better way to operate.
Okay. And so what I'm hearing
we have been doing.
Yeah. So what I'm hearing from you, Dawn, is guidance from other communities about how their committees are structured, how they make decisions.
Right. And what other strategies that they have in place that have been successful.
Okay.
And I understand Commissioner Jacobs saying that it's a misrepresentation to say that all we doing on the naloxone and syringes, but that's all I've heard a lot of since I've been in this committee. And that a lot of money has been or is being recommended for syringes and naloxone. That's not a misstatement. And so I want to know what other communities are doing, what other strategies they have in place in addition to those two things that are successful.
Yep.
Because it's not unknown that, yes, we need more recovery housing and all those things. So I think it's important for us to figure out how other committees are functioning and making processes and decisions before we move forward.
Okay. Thank you. And Karen? You're on mute, I think. Yeah.
Thanks. I'm wondering if Commissioner Jacobs, the person, Nitty, the person who's over everyone, I wonder if she would have a recommendation of a county that she feels like has got a really solid process. Is that I'm just trying to figure out who might be able to help us find that.
Davy. Yeah, she's working for the North Carolina Association of County Commissioners to implement the opioid settlement funding. So, I mean, Jason can work with her for sure.
And I want to welcome Alonza to the committee meeting. Hello, Alonza. Glad to see you. Glad you're here.
Good evening, everyone.
Right. And Jamie.
I just am wondering if we, as a committee, are going to be able to, at our debrief, kind of come up with our strategy. I mean, I feel like I've learned a lot from this cycle, and I feel like we were all like very intimately involved with it over the last couple months, and I'm just not totally sure we need to like get the insight from another area about, oh, this is how you guys do it. I think like we maybe can come up with a better a better way to do our RFP next cycle kind of internally. Personally, I would vote for not spending time on kind of getting that feedback from other areas and from hearing more about gaps in Durham and anticipated needs for over the next year.
Yeah, I mean, that's one of the desired outcomes from the debrief meeting, but I'm gonna go to Paul, and I think we probably need to vote on the two options so we can go ahead and finish up our calendar or continue making our calendar. Go ahead, Paul.
Yeah, I guess just I just it just feels like we are kind of walking in the dark here about some things, and I guess I might just be asking Jason here, do we have a sense of what the process is for other counties? I mean, I'm just kind of, or did we do it? We just didn't do it maybe as effectively as maybe others did. I just don't know. I just feel like I'm in the dark about the process question myself.
I would also say that if we do decide to invite in or to learn more about what other communities are doing, which I think is a great idea, we should definitely pick a community that is similar to Durham as far as demographics, population, like a peer community, right? So that's just something else that I just want to throw out there. But let's go ahead and vote, y'all, because we do have to make a decision about this calendar. So we're going to have the debrief session next month, where we hope we will come out of that meeting with clear agreement about how we will manage next year's RFP process, the recommendations. So the first option is to, I got getting my options in the wrong order. Option one is to invite in or learn from successful demonstrations from other communities about their committee structure, their process decision, their specific strategies, all of that in August. And then option two is that we invite in the co-chairs from Durham Joins Together in August and learn from them about what's happening here in Durham as far as gaps and what they see. So I'm going to just go through by last name. And so if you could just say option one, option two, we want to do it that way. Or do you want to let's just do it that way. So I'm going to start with Baxton.
Option one.
Carter.
Option two.
Jacobs.
Option two.
Kelly.
Option two.
And Nagy.
Oh, option one.
And Pamplin.
Option one.
And Wilson.
I'm so sorry, Ashley. So I was talking to a participant. Can you give me the 5-second reminder of what option one and option two are?
Sure. Option one is we learn about other communities, how their advisory committees are structured, how they make their decisions, what are lessons learned, what strategies they're prioritizing. And then option two is inviting Durham joins together the co-chairs from their committees and learning about gaps here in Durham.
Option
two. Okay. And for myself, I'll vote for option two. So let's see. That's 1, 2, 3, 4, 5 for option two. 1, 2, 3, 4, option one for August. So it doesn't mean that we're not going to do option two. It's just not going to happen. I mean, option one, it's not going to happen in August. Do y'all want to move this option to September, or not this option, this learning priority to September? Okay, so we will. So after we hear from Durham Joins Together in August, the next month, we'll hear about what's happening in other counties successfully. And also, this might be a good time for us to think about in October, that's when we hope to invite in the grantees to hear updates from them. Remember also, we need to revise our bylaws to include how we're going to make decisions about next year's process or recommendations for next year. Do y'all want to try to do this in October, like have a split meeting where because by that time we've heard about, we've had our debrief meeting, we've heard from other communities. Do you feel like in addition to having the grantees, that we could go ahead and also revise our bylaws? Or do you want to have that for November? For November, revise the bylaws. That might give us enough time. Go ahead. Yeah. I just saw somebody's hands up, or someone's giving me thumbs up. Okay.
I just put my hand up.
I'm sorry. Kim.
I think maybe that after our debrief meeting, we may be able to like start working on a draft that's we're working on sort of throughout the following few months. So that hopefully, I mean, I think it's always really hard to draft a document in a committee meeting, that I think it works better if there's like a small group that drafts it and then goes out. That would be my personal preference, but it seems like I would hate to wait from June all the way till October or November, when it seems like we're going to have a lot of the information about what we want to do after June.
Uh-huh. Go ahead, Dawn. I see your hand up as well. Go ahead.
How are we going to do that when it's obvious everybody is confused about how we should be functioning? Which was why I recommend option 1 first. How are we going to write bylaws to put in what we feel should be the process that we should follow starting in June, when almost everyone here feels like they're operating in the dark?
Yeah.
I'm just figuring out how that's supposed to be effective.
Yeah, I think in June we can come up with some initial agreements about how we're going to work together as a group. But I do think the whole or a big reason why we wanted to hear from folks in September was to see if we could improve our process, right? So I think, at least this is how I'm advocating that it be maybe around after we hear from the grantees in October. That might give us enough time to look back at what we thought would be great practices, and then we hear about something from another community. How does the rest of the committee feel about doing the bylaws revisions in November? And I do agree, Karen. I think it should be probably a small group coming together to actually do the draft, and not doing it like in a big committee meeting. Just because we should bring back a draft for the committee to react to. How does the group feel about November being the time when we revise our bylaws? Do we need to vote? I don't see. Can I get thumbs up? I see a couple of thumbs up. Thumbs up. Okay.
I'm just a little worried that well, I guess I don't know if this is still a priority, but I thought that we had talked about like trying to have, a time when, okay, some representatives from harm reduction come, and and I know some representatives from treatment providers, the EED, outpatient, and just kind of really hear like what's happening on the ground. I guess Durham Joints Together will be representing those gaps to some degree, but this doesn't seem like we're going to have much time for any of those more focused sessions with the actual people doing the work in Durham. And I don't know if we're going to maybe we won't be able to do that before the next RFP, but I do think that would be really useful to hear before the next RFP. I just found myself wondering a lot of the time in reviewing applications, like, is this proposed project going to fit into what is a gap, or is this work actually already being done successfully? Just kind of hearing more about the landscape from people doing the work. And also, I think anticipated needs, like what's changed. As a treatment provider, I am seeing how like the way that we're even starting people on medication for opioid use disorder is rapidly evolving, and I'm like looking ahead thinking like, how are we going to be able to even do this in Durham? And so I think like there's just things like that I think insights that would come from hearing from people doing the work. So I hope we have a chance to do that. I know we're just working with a tight schedule, so
instead of us having like a whole month where we work on the bylaws, maybe we should go back to thinking about what Karen said, and also what Wendy just put in the chat. Maybe we form a working group in September, and that working group then comes with the draft of the new bylaws at the October meeting. And then the committee votes to approve or not approve those bylaws. How about that? So we don't have to spend a whole meeting on that because again, we probably want a working group to focus on getting the draft together. And then just as part of the meeting in October, this committee approves or does not approve those bylaws. How is that? And then we could have still November, December, January, and February to invite in other guests to learn about the things that you just talked about, Jamie.
And I agree with Karen. I do think we could start working on the bylaws like after our debrief, even if we have them as just like, okay, this is our internal draft, and then we hear from the external organizations or external counties and maybe update. I think we should just get started on the bylaws as soon as possible.
Yeah. Jason?
Yes. Hey, Lisa, I just wanted to make a comment just in clarification around the bylaws. So they're already drafted, and already been vetted by our county attorney, Christy Mallett. So I think that's something that you guys could probably, make some comments around, maybe a track changes type of document. And then once you guys, put your input and recommendations around it, I will send it back to Christy and also the county attorney's office as well. But I just want to make a clarification that that draft is already drafted,
Okay.
and was actually already approved back in December. And so you guys are just making revisions to it based off of a revised process. So just wanted to make sure you guys can save some time with that, if that's helpful. So I can send it to you, Shalisa, and then you can send it out to the committee so that way they can make some comments around the bylaws, and then we can make the changes on the county side.
Okay. So the comments, Jason, would it be fine for us to send back comments by email, or would this be a discussion that the committee would need to have on one of our meetings?
It's completely up to you guys.
Okay. Go ahead, Karen.
So I thought we were talking about at least this portion of the bylaws being a clear process around how the RFP goes out, how we then evaluate applications. Is that what I was understanding to be the portion of the bylaws that we will still, and is that, Jason, what there's already a draft for? Or or is that section not drafted at all? I thought that section was not drafted at all.
Yeah, I do.
Yeah, we don't have a section for how decisions are made around that, and I think one of the reasons why is that Durham County procurement already has a process in place on how we do RFP processes, which was laid out in the RFP. So if you guys want to make recommendations around that to be revised in some way, then I think you guys could add comments in, and then I could take that back and see if that's going to align with Durham County's procurement office, and then we can kind of go from there if that makes sense.
Yeah, because that portion of the bylaws has to match or line up with the county's procurement practices. So it wouldn't necessarily, I think definitely we should provide feedback and comments about it, but it wouldn't be like starting from fresh from what I'm understanding now, Jason, right? Because we're starting first with the procurement practices of the county. So maybe the committee can work on that in June. If Jason, you can send us the draft, and then again, as part of this debrief process, we can discuss it at that meeting. And then, Jason, is there a timeline? So if we wanted to take a little bit more time, and especially after we hear back from the folks in September, would it be fine to have the final committee say so or approval or about this addition to the bylaws in October?
I think that's fine if that works for you. I'm just taking a recommendation from our county attorney's office, and that was to get the bylaws approved sooner than later. In terms of that, that way we have working bylaws. But yeah, I'm working off of those recommendations there from their office.
So we'll just have
So
this as like as a deadline
that's
then.
fine.
And then that way we can have time to learn about other communities' And also then also get through, have our debrief in June. So now getting back to Jamie's question about, inviting in harm reduction. And I think up here at the list that we started last time was a lot of the service providers, so like Alliance Health, the Heart Team, the Hope Team, harm reduction workers, Durham County Emergency Management, treatment services. I think those were the kind of groups that we had talked about having as a panel at some point. Would y'all like to have this panel of local providers be in November? And I think also the other thing I'll say before the group, before y'all tell me what you want to do, is a lot of the questions that we identified back in March was for that panel. So would you like to have them come in November, invite them in November?
I was thinking that we had said like maybe we would have, everyone sort of in the treatment space in different ranges, in different parts of treatment. And then I don't know, just kind of like grouping some of those different people, but maybe having like not all of them all at once necessarily. So maybe I don't know if we have time over the next couple of sessions to do that, but I think definitely also hearing from Alliance and or funders about gaps in, anticipated gaps with changes to Medicaid and other funding streams that are available and things like that would be a priority.
Okay.
But
So
that might be a different discussion than like what a treatment provider is seeing on the ground.
yeah, I'm just putting them beside each other for right now, because what are the other categories of a panelist that we want to invite in? We have treatment providers, Alliance, funders. Going back up top, there was Durham County Emergency Department, but I think, they'd be invited in for the grantees meeting. Do we want housing providers, the Heart Team, the Hope group that's part of the City of Durham's Community Safety Department?
Yeah, I would say maybe like harm reduction providers and also like the Heart Team. I could see that going well together, kind of people who are really like going out, meeting people where they are and doing work really out on the ground in the community. Maybe the other homelessness organizations or housing fits into that, or maybe housing is a separate.
Yeah. The Hope Team, that they're actually the group that manages like the continuum of care, and also housing stabilization for the city's Department of Community Safety. Go ahead, Paul.
Yeah, I may have missed it. Sorry if I did. Did we also say the Criminal Justice Resource Center, or however they're referred to these days, and the jail? Did we mention those things? I'm sorry if I missed it.
Yeah. Justice Services Department and Justice Resource Center.
Okay.
And they also do the recovery courts, both drug and mental health related courts.
What was the second group you mentioned? Just Criminal Justice Services and Justice?
Well, we call it, we dropped the criminal part. We call Justice Services Resource Center.
Okay.
And well, it's all part of the Justice Services Department.
Okay.
But yeah, so they run all of the reentry, jail, mental health, and the recovery court, and the drug court, mental health court.
Mm-hmm.
Yeah, historically, it's a pretty comprehensive set of services there.
So we have several categories, and y'all have said that some of these groupings like make sense. So the treatment providers, that sounds like it'd be several different groups. So maybe that's a panel all by itself. Alliance and funders also sounds like it may be a panel all by itself. And then harm reduction, Heart, Hope, maybe those three stakeholder groups could join together on a panel, and then the Justice Services Department. How would y'all like to fill out our calendar? We're already at we have November, December, January, and February. So who would you like to invite in for November?
I think it'd be great to hear from Alliance early, and then that could possibly go with treatment providers too, since I think like a lot of what Alliance funds is treatment. Um,
Alliance and treatment providers for November? Yes, no, thumbs up. All right, so we're gonna have Alliance, we're gonna invite in Alliance and treatment providers for November. Now, what about the second group, which is like harm reduction, heart, and the hope group for December or January or February? Or should we just go ahead and just do this that way, like this? And then in February, we still have room to invite another group. And so maybe by the time we get to November, we could say, oh, who else do we want to hear from before we start getting into the recommendations process? And of course, this is going to depend on their availability too, right? But how does our calendar look to y'all? Should we do a vote on the calendar? All right, so we're going to vote on the calendar now. So let me see if I can make it so we can see all of the options all together. I know it's going to be small. Actually, let me put it down on one page. So here's our proposed learning calendar over the next few months. So I'm going to just go straight down again alphabetically. So starting with Baxton.
Yes.
Carter.
yes,
Jacobs.
Yes.
Kelly.
Yes.
Nagy.
Yes.
Pamplin.
Yes.
Wilson.
Yes.
And I also vote yes. So we have a calendar now. So we need to, I think we already have a lot of the folks identify the potential guest speakers. So we'll continue working with Jason also to find other guest speakers that we may not know of. But we'll start getting out invitations to the folks that we've identified for the different topics. The last thing we have on our agenda today is to talk about the next steps and the agenda items for our next meeting. And so we've already talked a little bit about having the June meeting be for the debrief of the process that the committee just completed. We are, Brittany and I are proposing that this meeting be in person. How does the rest of you all feel? Like it just maybe just better to have the discussion in person and not just to just debrief about what went well, what didn't go well, but also like what agreements, are we going to have moving forward to make sure our process is better moving forward next year? So how about, let's see, I see some folks giving some enthusiastic support of us having an in-person meeting. Is an in-person meeting, would it be, is everyone able to participate in that in-person meeting, or do we need to maybe change the time for our in-person meeting? Our next meeting, it will be on June 10th. Do y'all want to start at 5:30 and go to 7, or are you still good with starting at 5? Since it's right after work, what time do you want to start?
I'll vote for 5 myself, but whatever works for most or better.
I
Bye.
think usually, like I'm going to a Board of County Commissioners meeting at 7. So I think I would probably need to start at 5.
Is anyone starting at 5 would be something that, would be difficult for you? Knowing it's an in-person meeting, having to travel maybe after work.
This is often I have outreach until 6 on Wednesdays, which is why I normally call in. But if we're gonna do it in person, I can try to find coverage so I can leave early and come meet y'all.
Okay, thank you.
Oh, I'm sorry. Is that not a Monday, Shalisa, the 10th?
No, our next meeting is going to be on a Wednesday.
Oh, okay. Then I'm okay. Sorry. Disregard what I said.
And Alonza's saying if she starts at 5, she'll be a little late, have to do pick up and drop off. So since now, so are we still good with starting at 5 then, or a little bit after 5? Maybe we can have like, a little social time or something like, and then start like maybe 5:15, give everyone time to get in. Okay. All right. So we'll schedule for 5, the debrief. Brittany and I will work with Jason to find a in-person place for us or a meeting space for us. And also we'll be probably sending out a document ahead of the meeting. Nothing that we hope, you won't spend too much time on, but just to help us get our thinking ready for this debrief meeting. Is there anything else that the committee wants to discuss or put on the table before we end tonight? Okay.
I just want to appreciate you for facilitating this. Thank you.
Oh, you're welcome. Thank you. Thank you all for being here. Do we have a motion to adjourn?
I'm happy to step up and offer that.
Okay, thank you.
I will second it.
Thank you. Everyone in favor of adjourning, please say yes or aye.
Yes, and
Aye.
Yeah.
Thank you, everyone. See y'all soon in June in person. Thank you so much. Thank you. Bye-bye.